Same.
Absolutely.
So what do you like to treat? What do you in the Western mindset of things, what do you specialize in, if anything?
I actually work specifically with women.
Okay.
I help women in pain who also have been affected by addictive or alcohol-free.
Okay.
I help them sober women who address things in their life that can be addressed by other modalities. So, for instance, a woman who might be going through a difficult addictive relationship may be experiencing increased fasting or pain. So we really work on the emotional piece and we work on the physical piece.
The two being related, of course.
Yeah.
And so does cranio-sacral therapy work well with other forms of treatment, the Western drug therapy, chiropractic, acupuncture, and so forth?
Absolutely. I sometimes have clients who we have a team where we have an acupuncturist, a chiropractor who's adopting maybe certain information. I also work with social workers. Sometimes it's just two of us together. So teleworking is a comprehensive type of medicine.
So how many we'll be taking a trip to your office shortly here. We're bringing everybody with us, giving them the tour and the little show and tell. But how many visits should one expect, to know if they're on the right path? We have patients come to me or chiropractor, and they always want to know how many visits is it going to take, or how many visits is it going to take till I know if it's working, that kind of thing. So how I know how I answer that. I'd like you to answer that.
Okay. First of all, it depends upon the person and their specific problem, how long it's been going on, and also their medical history. If they've taken care of themselves, too. So there are a couple of different variables involved. For key acuity, a significant change, I recommend at least 3 to 5, 3 to 6 visits.
Okay.
Sometimes I've had a change in 1 or 2 visits, and the person can be totally fine. I've had other instances where they work within a couple of months. After they've gotten to the point where they've moved forward, they can get back to their life and exercise. Sometimes I may see them, once a month, just depending on what they have.
Okay. And what have we covered that you'd like the viewers to know about cranio-sacral therapy?
Well, it's really right thinking. It's really a transformation type of therapy. And I call it a ripple effect. Because when we're addressing the central nervous system, we're not just addressing the person's pain. We're addressing helping them have better relationships, helping them have better quality of life, increase confidence in themselves, increase clarity, increase focus, better relationships at work. So there's really a ripple effect in addressing them.
It's interesting how much, if you were interviewing me, I feel like we'd be saying a lot of the same answers, which is interesting about the similarities in alternative medicine, but also the effectiveness of all these different parts of alternative medicine.
And I do want to add that quite often when people go to see, they're asking under the road, they kind of look at this, and then they kind of guess.
Yeah.
And we're still hoping for.
Yeah, and it's amazing. I think that the interesting thing about practice is and I've had this conversation. I come from a Western medical family. I have friends that are chiropractors. And all of us say the same thing. And so really it is about meeting that right person at the right time kind of thing, regardless of the form of medicine. And so where is the South Shore Healing Center?
South Shore Healing Center is at 40 Tassinari Street, Building 11.
Okay.
Unit 57, and on the first floor.
Duxbury.
Duxbury.
There we go. And let's give everybody your website and phone number.
My website is www.southshorehealingcenter.com. And my phone is 781-924-0100. Paul, I'd also like to offer our audience today a free gift at my website. just go to, again, facelessname.com, sign up in the opt-in box for your free password to freedom guide.
Great. Hope everybody does that. Martha, tell the viewers, tell me what you do for somebody who had a headache.
Okay, for example, I would first do a big evaluation of your posture, and from there I would decide what techniques I would want to do. So, a common technique for someone with a headache is to do what's called cranio-sacral, where I get right underneath and fall in the first vertebrae of the neck, and I do a release on my legs in this position.
I've had this done. It feels awesome.
Okay, it's wonderful.
Mm-hmm.
What it does is it affects major nerves in our body that affect my brain.
The vagus nerve?
The vagus nerve is very good. Very good. So, and vagus nerve, as we know, is the major player.
Yes.
It affects everything in our body.
Digestive system, respiration, all these things.
Absolutely. That's right. So that's a branding that we do. Just like a bone right here, this yellow bone right here.
Mm-hmm.
It's called a
sphenoid.
Which is, as you can see, it attaches to the back of the skull and some of the bones of the body. And it also attaches to our sacrum, the lower part of our back, by some membranes like the spinal cord. So quite often in a car accident, for example, this sphenoid bone may be out of sync with the other bones. So quite often when we mobilize this particular bone,
okay.
People with headaches. This is the command center of the head, basically.
Wow. Wow.
So that's a feeling very clear.
Well, thank you for bringing your toys along and showing us.
My pleasure.
I want to thank you very much for being here today. And I think it was really great talking to you. And I really want everybody to come along. Hope you would come along and see Martha's office. We're going to go there right now.
Hi, we're here at Martha Tassinari's office, South Shore Healing Center, and Martha is going to show us what she does. Hi, Martha.
Hi, Paul.
Can you tell us what a first-time client can expect when they come to your office?
Absolutely. The first consult and evaluation is approximately 90 minutes. And what we do is I have my client fill out a history form of why they came to me, what they're struggling with, what their specific goals are, what types of treatment perhaps they've tried in the past that hasn't worked for them. So we spend a good 20 to 25 minutes just talking, getting to know each other. And then I bring them into this treatment room and I have them in standing and I do a postural evaluation to check their alignment. And then after that's complete, I have them lay on the table and I start at their feet looking at their alignment in that particular position. Then I'll start and I'll move up the entire body, really checking alignment, any discomfort they may be having, whether they're suffering from migraines or lower back pain. And today what I'd like to show you is just different hand positions I would use for lower back pain. And so I'll move right into it.
Great. So, and maybe before you start working on our client, can you tell people briefly what they should expect during and after a treatment?
Yes. During a treatment, a client may start to feel very relaxed. They may feel tissues start to soften. They may feel a release happen in their body. And by release, just a sense of relaxation. And sometimes memories or thoughts may kind of go in their head. And they sometimes get into a deep meditative state. Quite often, people get so relaxed. I've had people fall asleep on the table before.
Wow.
Depending upon their situation. And from there, sometimes we do some dialoguing. If something specific comes up for them, they may recall a memory that may be a happy memory or maybe a sad memory. Maybe they're holding it in their tissues, and all of a sudden they'll release it emotionally and physically.
And in that in that initial consultation before they get on the table, you've gone over that with them so they feel they kind of have had some coaching so they know that they can
Yeah.
talk to you about that. And